I'm Dr. Gayathri, a senior consultant in fetal medicine, birthright by Rainbow Hospitals, Hyderabad. But total my journey on this fetal medicine is 20 years. Fetal medicine is basically of arbitrarily divided into two divisions. One is the fetal diagnosis. That is, it's an ever evolving subject where ultrasound is used as a tool to look at the babies, to evaluate the babies. And of course, we use the various blood tests, the biochemical tests to enhance the accuracy of the screening. So, in those cases where the genetic diagnosis or the suspicion is done, we use the further tests like putting a needle into the womb, taking the fluid out, and sending for the genetic test. Those tests are called amniocentesis or the fetal blood sampling. So, that is all about the diagnosis. Sometimes fetal MRI is also used improve the diagnosis because it delineates the lesions better. But whereas the fetal therapy, it is about the medical or the surgical treatment of the fetus. So the other example might be a twins tumor. So twins are of two types, identical and the unidentical twins. In the identical twins, there is a placenta. That placenta, this has the blood vessels. So if there are communications between both the blood vessels, that leads to a lot of problems. One might get more blood supply or the second might get less blood supply. Or there are communications between both the vessels. This leads to many complications. Almost 25% of these identical twins have these kind of complications, even though they are otherwise structurally and genetically normal. So these can lead to, the cardiac decompensation of one baby and the other baby. So both babies gets affected. Or one baby becomes anemic, other baby becomes more plethoric. Plethoric means lot of blood supply. So cutting these blood vessels at a right time by a process called fetoscopy. Fetoscopy is a tiny camera and is introduced into the mother's womb like the laparoscopy, and also the instruments are used and the laser is used to coagulate those blood vessels. So it leads to, it's like separating both the blood vessels. Therefore, both babies survive in these cases. Therefore, the ultimate aim is to, treat the babies for a better survival, and also the quality of life becomes better. And in fact, life chances become better. So we at Rainbow do a lot of cases of this because they come as referrals to us, and probably we have done more than 500 cases as a whole from all the units. And in fact, the survival rate of the fetuses in these cases is more than, I think, 98%. So that's awesome in these cases. And the most important thing, as I said, is a fetoscopy. Fetoscopy is again a tiny, camera which is introduced into the babies and to the mother's womb, and it can look at all the baby, and also the other instruments are used. So we are being used this interstitial laser in the cases of the triplet pregnancies. That is, 3 fetuses are there, and usually 2 babies, when there is a problem with them, that would be reduced by using these needles, protein needles and a chemical. But of late, the newer technique is using these techniques like laser or radiofrequency ablation to treat those fetuses where, like this triplet pregnancy becomes a twin pregnancy. And that's a dream for the, parents to have in their long infertility life, to have 2 babies at the same time. And also we have done one case of radiofrequency ablation where it is a complex pregnancy where out of these 2 babies, both of them have a problem. So of the deceased baby, we have applied this radiofrequency ablation and coagulated the blood vessels of the baby. So the other baby has the good chance of development. And now the pregnancy reached by around 10 weeks. And I'm sure it will continue until term, and it leads to a twin pregnancy, which is good. We are fortunate to be in this birthright by Rainbow Hospitals for the precise diagnosis. And also, this requires a multidisciplinary team. Being empathetic with the patients always helps us to, explain them better. The team is the most important part of it. And they will help us to evaluate the things better. So a team of, in the case of the fetal therapy, I think the team is all about with the fetal medicine specialists, obstetricians, the neonatologists, the pediatric surgeons, the cardiologists sometimes, and the anesthesia team also. Definitely this is an advantage from the birthright Rainbow to deal with this kind of cases as compared to any other units. We work with the geneticist, I think almost every day. Pediatric cardiologist, whenever a case we come across. Pediatric neurologist, again, because we have got a very, ours is a very good referral unit. I think we see around 5 to 8 referral units every day. And all these cases probably we need to collaborate. Definitely the obstetrician and sometimes the geneticist or the cardiologist or the pediatric neurologist. In fact, it's improving, but many of them doesn't know that these therapies are also there. So, lot of awareness about the fetal medicine, and in fact, the therapies requires to be improved. It's an evolving medicine, and in these cases, the risk versus the benefits. There are many debates about this. Fetal therapy. Therapy should be very adequately explained to the parents. I think, explaining about the cases, what are done. Because we keep seeing such kind of cases like, okay, that case, that survived very well. That's the reason we are coming again. So, if this reaches more to many people by explaining the cases which are done, one-on-one discussion with whomever has come with that kind of approach, then probably that will help to have a reach to the patients where this thing is required. I think the training of the fetal medicine is also increased a lot. So probably we are hoping a better reach to the required couples. Again, the fetal medicine is not just scanning. We should realize that it's not just scanning. So the fetal therapy, I can say, is a very remarkable coalition of many things. Probably, the expertise, the treatment, and the technology, and also the compassion. Therefore, it's not only the treating the fetus, but the outcomes. It has a best start of the